Good afternoon, everybody, and it certainly is great to see you all today. And welcome to our Healthy Mom, Strong Baby series today. We are having an amazing conversation with some amazing women today, and a very important discussion. Today, we're going to be talking about COVID-19, some of the myths, especially around the vaccine, debunking some of those myths, and really exploring everything that you all need to know about COVID-19 and the vaccine as relates to pregnancy, fertility, breastfeeding, and so much more. And I know this is a really timely conversation because I know that there are still lots of concerns and lots of questions that many people have about what the vaccine means for them, how to be thinking about it in light of COVID-19 and in light of this surge of the Delta variant of COVID-19 that is really taking hold in many, many parts of the country. And we know with so many medical recommendations around COVID-19 evolving, there's always this risk, and certainly we've seen it, the spread of really dangerous misinformation is out there. So we want to make sure that you know at the March of Dimes, you can always come to the March of Dimes and get the most credible and trusted information from the best experts possible, so that you can be as informed as possible and make the best and most informed decision for you and your family. And that's what this is really all about today. So we have this incredible panel. I'm going to introduce them in just a minute. Before we get going on it, I just want to say a couple of things. One thing that you're going to hear a lot today, and unapologetically so, is that the COVID-19 vaccines are safe for pregnant and lactating breastfeeding women, period. And they are also recommended for pregnant people, for breastfeeding women. It is recommended to be vaccinated against COVID-19. And that's especially true now that we have a more transmissible, more dangerous variant that is circulating through our communities. There is new safety data released this past week that found no increased risk of miscarriage among those who were immunized during the first 20 weeks of gestation. And this is not just the March of Dimes saying this. These are other reputable organizations that we have partnered with for many, many years. The American College of Obstetricians and Gynecologists, we call it ACOG, the Society for Maternal Fetal Medicine, the American Academy of Pediatrics, the American Society for Reproductive Medicine, and the Society for Reproductive Endocrinology and Infertility. All of these reputable professional organizations have all said and all published similar statements reinforcing the efficacy of vaccines for pregnant women and breastfeeding women as well. Also, another thing you'll hear is that as of now, there is no evidence that COVID-19 vaccines affect fertility. And again, that's not just from the March of Dimes, it's also from the American College of Obstetricians and Gynecologists, ACOG, who recommend that COVID-19 vaccination should be given to all people who are eligible to get the vaccine and are considering a future pregnancy. That there's no reason to delay pregnancy after completing the vaccine series as the rest of the recommendation. So this month, August, is Breastfeeding Awareness Month. So of course, we want to make sure if you're breastfeeding, you also have all of the information that you need, and the potential ways in which you can protect your baby from getting COVID-19, you can protect yourself from getting it as you're breastfeeding. The good thing is that studies have shown that the breast milk of people who get the vaccine may contain COVID-19 antibodies. That's a good thing. And recent research has shown that pregnant people who get the COVID-19 vaccine in the third trimester of pregnancy can pass protective COVID-19 antibodies to their babies. So the bottom line is getting the COVID-19 vaccine while you're breastfeeding can actually be really helpful to protect you and your baby. So we have actually experts who are going to go through this a little bit more. That kind of frames a lot of the themes out of the conversation that you'll hear today. But I'm going to stop now and introduce some of our amazing panelists. I'm so pleased to be joined by many of them. And I think we have one more who has not joined, who is having some technical difficulties and will soon be joining, we hope. But let me get into the introductions. First, I want to introduce our interim head of our mission activities here at the March of Dimes. She is the Senior Vice President and Deputy Chief Medical and Health Officer. She is leading the Office of Maternal and Child Health Impact and provides strategic direction and clinical expertise across the organization. to address the maternal and infant health crisis, and has been our key expert that we relied on through the pandemic to provide really sound advice on how to think about COVID-19 and the vaccine as relates to pregnant and breastfeeding women. She is a board certified OBGYN with more than 15 years of experience managing numerous maternal and infant health initiatives, including the establishment of the National Network of Perinatal Quality Collaboratives. She came to the March of Dimes from CDC. So we're very, very fortunate to have Dr. Shakiba Henderson with the March of Dimes joining us today. Thank you, Dr. Henderson. And next we have Dr. Andrea Edlow. Dr. Edlow is an assistant professor of OBGYN at Harvard Medical School, and she is a maternal fetal medicine specialist at Massachusetts General Hospital. She is also an investigator at the Vincent Center for Reproductive Biology at Massachusetts General Hospital, where she runs her own lab. She has received support for her research from the March of Dimes. She's going to be talking about some of the research that she has done, looking at the issue of COVID-19 and its current and future impact on moms and babies. So we're really, really fortunate to have Dr. Edlow with us. Dr. Edlow, thank you for joining.
Thanks so much for having me.
Next, we have Lucy Fink, and we're so pleased to have Lucy with us. A lot of people know Lucy because she's an award-winning digital creator who produces original video content for an audience of millions across many, many channels: YouTube, Instagram, TikTok, and other channels. Today, Lucy is signed with United Talent Agency. Since announcing this summer, Lucy has been chronicling her own pregnancy journey on her own YouTube channel. And she recently shared her decision to get the COVID-19 vaccine while in her first trimester of pregnancy. And she'll be sharing more about that. So we're really pleased to have Lucy with us to share her own personal experience of how she made that choice for herself and her baby as well. So let's get into it. I'm going to start it off with Dr. Henderson, and I'll go to the other participants as well. Dr. Henderson, first of all, it's great to have you as our own March of Dimes expert on so many of these issues. And sort of as an OBGYN, and we know Dr. Edlow is as well, but as an OBGYN yourself, please explain to us why it's so important that pregnant women receive the COVID-19 vaccine.
It's so important, and I think we need to really get the message across to pregnant and birthing people that contracting the COVID-19 virus puts them at an increased risk of complications, increased risk of hospitalization, and even intubation and having to be in an intensive care unit, and also increased risk of death. And aside from the complications for mom, we have to also recognize and acknowledge and make sure people understand that the infection also can cause problems for the pregnancy and for the baby. There was a recent study that came out that shows that COVID-19 infection can give an up to 60% increased risk of preterm birth. So babies being born too early and being exposed to potential complications of being born too early. And I just want to stress, I couldn't stress enough that, people are so worried about taking medications or vaccines during pregnancy, but fail to think about the complications of the infection itself. And we fear the vaccine, but there needs to be a respect and a fear for the infection and the complications it can cause.
Even more so, right? I mean, one of the things that I hear a lot, I'm sure you all do too, especially from younger women, is I don't want to do anything that's going to affect my fertility. So what would you say to women who have been concerned, women who think they may want to be pregnant one day even soon? What would you say to them today about getting the COVID-19 vaccine and what impact it could have on their fertility, if at all?
So this is actually one of the most mind-boggling myths that have been circulating about this vaccine that really needs to be debunked. And it's been used as an excuse, not only by women, but even by men for not being vaccinated. There is no evidence that shows that COVID-19 vaccination impacts fertility. We have combined evidence from both animal studies and also ongoing evidence from real life experience, and also from the studies of the vaccine from the trials, that the vaccines do not impact infertility, and that's both for male and female. There are animal studies in rats that show no impact on fertility. You have people who were enrolled in trials who inadvertently became pregnant and were able to get pregnant during the trials. And then we have, we have surveillance of pregnant women who've received the vaccine, starting with pregnant people, the early healthcare providers who got the vaccine earlier on when vaccine was available, and also ongoing information tracking outcomes of pregnant women. And there continues to be no evidence of any impact on fertility.
And then no impact on birth outcomes either, right?
Absolutely. Another concern, you mentioned, there are concerns of people taking the vaccine or other medications early on in the pregnancy, and concern about miscarriage. And we have even mounting evidence that shows that there is no increased risk of miscarriage for those who are vaccinated. The CDC just released a study last week showing that there is no increased risk of miscarriage, and added the recommendation that pregnant women should receive the vaccine.
Great. So that's from Dr. Shakiba Henderson, who is a board certified OBGYN. I want to turn to another OBGYN here, who is also a researcher. Dr. Edlow, you have conducted a study that is one of the largest studies to date on the vaccine and pregnant and lactating individuals. So tell us why you wanted to conduct this study.
Unfortunately, pregnant and lactating individuals are some of the groups that are most left out of research, especially about vaccines and novel therapeutics. And unfortunately, we saw time and time again during the pandemic that pregnant and lactating individuals were left behind by research, and particularly research that could be life-saving for them. As Dr. Henderson noted, pregnant women are more likely to be admitted to the ICU, to be intubated or need a breathing tube, to need heart-lung bypass, and even to die. So these are some people that could benefit the most from vaccines and from monoclonal antibodies or some of these other medications like remdesivir. But unfortunately, the best data that we have are just observational, and they weren't included in initial trials. So when the mRNA vaccines first came out, the trials showed that they were very effective and safe with a low, rate of any adverse events in non-pregnant populations, but people really hadn't looked at it in great detail in pregnancy. And as an OBGYN, seeing patients day in and day out, and in an urban setting where there are a lot of COVID-19 infections during particular hotspots in the pandemic, it was very relevant for me to be able to tell my patients real information and hard data about the vaccine, rather than just telling them, well, we think it might work for you, or we think it's safe in you because it was safe in these other people that really don't necessarily have as much in common with you. So that was the motivation for trying to study the vaccine in pregnant people who chose to get the vaccine when the emergency use authorization came out. And interestingly, largely during the study period that we did that, which was December to February, a lot of those individuals were healthcare workers or hospital employees. So I work for a large hospital system that has over 50,000 employees, and we were able to very quickly recruit 131 individuals who people were so eager to participate, ranging from food service workers and valet workers and front desk staff and unit clerks to physicians, nurses, MPs, PAs. So many people wanted to help. And I think that really spoke to how much pregnant and lactating individuals really want to participate in research, want to be given the chance to help other people like them in their situation. So that was really inspiring to us as a research team. And the main question that we wanted to ask, because we didn't have those hundreds of thousands of women that the CDC now knows about through their VSafe vaccine registry, we have really good data from over 150,000 women at this point who've received the COVID vaccines in pregnancy, that it's not associated with an increased risk for miscarriage or preterm birth or birth defects. And I would add to what Dr. Henderson said earlier, what is associated with an increased risk of preterm birth and potentially for stillbirth or miscarriage, although those data are less well established, is getting COVID in pregnancy. So it's not the COVID vaccine. But those types of data are better shown in really large groups. So that wasn't our goal, really, was to look at like pregnancy outcomes. We really wanted to look at the immune response, which you can look at in groups of like 100 women. So we showed that pregnant and lactating individuals have an immune response comparable to non-pregnant and lactating individuals. They mount a really robust and strong antibody response to the mRNA vaccines. And just because of our study period, which lasted through February of 2021, we did not yet get to look at the Johnson & Johnson vaccine, but we're actively looking at that now. And we anticipate that that will also be highly effective in pregnant and lactating individuals. But for me and for many of my colleagues, I think that was an important piece of information to be able to tell our patients when they're thinking about whether or not to take the vaccine. Step one is, yes, it works really well in you, just as it does in non-pregnant individuals. So that was the real motivation.
That's really great. And thank you for doing all that work, because that's what, you know, at the March Times, we've always been advocating for pregnant and lactating women to be included in clinical trials. And you know, obviously it was quite unfortunate early on when the vaccine came out that we didn't have enough data to really be able to show definitively to pregnant women and lactating women the evidence behind the vaccine. So the fact that we're supporting you and you are doing the work to provide and create that evidence and show that evidence is really, really important now, as we're still trying to manage through the pandemic. And Lucy, let me just turn it to you, because you, obviously you've been sharing your story a lot about your pregnancy, and you've been sharing your decision to get the vaccine really early on in your pregnancy. You also were, as I understand it, you were pre-med at some point at Johns Hopkins, right up the road from us in Baltimore. So that's kind of neat. Maybe that impacted how you looked at these things, but just tell us what your own personal journey was around becoming pregnant in the pandemic, and then how you thought about the vaccine and what ultimately led to your decision to get the vaccine.
Yeah, so when I first got pregnant, which was, I found out in early April, but I guess I conceived at the end of March, I really just, I kind of knew in my heart that what was going to happen was the moment I found out I was pregnant was the time when my age group was going to be eligible. And I just like knew I was going to have this crossroads decision to make. I actually had no fears about the vaccine affecting my fertility ahead of time. So I was hoping I would become eligible before I found out I was pregnant, just so I could kind of get it out of the way, because I knew I wanted to be vaccinated. But what ended up happening was the day I found out I was pregnant was pretty much the day my friends were going to get vaccinated. And I had an appointment scheduled for that week that I canceled because I wanted to talk to my doctors first. And I kind of had that initial fear, not knowing anyone who had gotten vaccinated in a first trimester and then had the baby yet. I think it was like too early. Maybe there were some healthcare workers that had already had a healthy baby after being vaccinated early on, but I couldn't find any information. I found people who were vaccinated in the second and third. And so I kind of felt like I was just taking a gamble. And I spoke to a couple of my doctors, my primary care doctor, as well as my OB. And I also I looked on the CDC's website, and I called the mother to baby hotline that they put on their website. And I spoke to a COVID vaccine expert, and pretty much across the board, you know, my OB said, if you were my sister, I would tell you to go get the vaccine right now. The CDC hotline, they can't actually tell you, you know, I guess at the time they couldn't tell us that it was recommended because it wasn't yet, but they sort of calmed all my fears about how the vaccine actually works in the body and its ability at all to even affect a fetus. And then the only doctor who told me that she would maybe wait until the second trimester was my primary care doctor, who just didn't have any information and was a little bit, I guess, being more conservative about it. But I wound up weighing everyone's opinions, and I decided to go with my OB's opinion to go get it. And so I ended up getting the first dose of the Pfizer vaccine at 7 weeks pregnant, and then went back at 10 weeks to get my second dose, and then was very pleased at my 12-week scan to find that my baby had 2 arms and 2 legs, which was mostly what I was afraid of. I mean, I think during the first trimester, there's a natural fear of miscarriage amongst everyone. I don't know the exact number, but I was told it was like, I don't know, 20% of pregnancies can end in miscarriage just right away. So I already had that fear of the 20%. And then I kind of just was nervous. I wasn't so nervous about it just causing a miscarriage, but I was nervous about it causing some sort of weird, like, alien baby to form inside of me. That was my personal fear. And I was very happy to find that everything was developing normally as time went on. And to be honest, my decision to get it, it was mostly based on remembering how I felt at March of last year when there was no vaccine, and when I couldn't imagine being pregnant during the time when it was just this danger zone in the world and there was no protection. And I just remember hearing about how lonely some people were in their pregnancies, specifically their first trimester of pregnancy, or specifically during COVID, being, isolated. And I knew that I would have some degree of loneliness throughout pregnancy, not being able to do certain things, but I just didn't want to add another layer by making it so I couldn't go do anything throughout this time.
And knowing that you're vaccinated now, you feel good about going to your prenatal appointments, and even if you have to get out of the house and do things, it gives you a layer of comfort, I'm sure, that you can go out and be at some level protected from really severe illness and protecting your baby. So I know that's got to feel good. And Lucy, I'll come back to you in just a second, especially on what you would tell other women who are in your situation, how to think about the vaccine. But we do have another guest who we have been expecting, and we're glad she's able to join. So I want to bring her into the conversation. Serena Vincent has joined us. Hi, Serena. Nice.
Hi,
to see
Stacy.
you.
Thank you, ladies. My apologies, misunderstanding. I thought it was Pacific time, 2 p.m.
Oh, that,
I had to get my toddler settled with someone, and I ran in. I'm so grateful to be here, and so I thank you for having me.
Oh, that's no problem. We all of us get that, make those mistakes from time to time. So it's no problem. And you came in right at a good time.
Okay, great.
A lot of people, let me just introduce you though. A lot of people may recognize you already because of so many film and television roles that you've had. Serena, you all may know, is an actress. She's a writer, and one half of the podcast Raising Amazing, which she co-hosts with Dr. Joel Gator. And that podcast is for parents who want to raise the bar on themselves as they're raising their own amazing children. So she shares a lot of information and has tons of interesting conversations about being a parent, and has talked with other pregnant and postpartum women about their struggles with life during the pandemic, including, I'm sure, these ideas and issues around the vaccine. She's a mom whose son was born just before the pandemic hit in February of 2019, and made the decision to be vaccinated while she was breastfeeding, as opposed to Lucy making the decision, when she was, as she's been early in her pregnancy. So Serena, we've been talking a lot. We've heard a lot about the importance of getting the vaccine during breastfeeding, during pregnancy. Lucy shared her own story. Tell us about your own decision to get the vaccine during the time you were also breastfeeding, and how you thought about it in terms of your own safety and the safety of your baby as well.
Yes, thank you. Well, so yeah, as you mentioned, my son was born in February of 2019. So when the pandemic started, he had just turned 1. So like he learned to walk during quarantine and all of the things. And I was like hoping to nurse, to make it, to that year mark breastfeeding. And then the pandemic hit, and I didn't go anywhere for a long time. So I continued to breastfeed, and I still am, and he's 2.5. So I'll first say that I lean more to like the natural sides of things. I'm all about homeopathic remedies and all kinds of natural remedies first, and then I take like antibiotics and things later. So but there wasn't a question for me about the vaccine. Sorry, I had many questions. I wanted to make sure that if I got it, that it was going to be okay for my son, that I'm still breastfeeding. And what I learned through my research and listening to a lot of experts and speaking to all the nurses and doctors in my life was that he would be getting the protection. He's getting my antibodies. So my 2.5-year-old can't get the vaccine. So correct me if I'm wrong, doctors on here. He can't get the vaccine, but if I have it, he's getting my antibodies. So, I once I understood that, and I thought it was really important to get it as soon as I could, and I got it as soon as I was able to. And but I was nervous, and because we've never been through this before. And I think, I mean, parenting and being pregnant and having a new baby, like there's so much fear. It's terrifying no matter what, and then add a pandemic and a deadly virus, and it's a lot for mothers.
Very stressful.
So very stressful. So anyway, I got it. I feel so much better that I did. And I want every mother to feel confident in this decision. There's so much that we're not confident about as mothers, right? We're just trying to like get through it, and it's messy. But this
Yeah.
is something that I feel like I want every mother to feel confident about. And I thank you all for doing this.
No, I think that's exactly right. And that's why we're doing this. And I think one of the things that if I'm just trying to put myself in the shoes of a woman who might be like you are, Lucy, pregnant, or you, Serena. And I think one of the things that I think would be helpful, and I'll turn it to Dr. Edlow to take this, and then Dr. Henderson, if you want to follow up on this. We do have a couple of questions from Facebook, and I think it's important to answer. I'd like to take both of them. And by the way, if you're listening and you have more questions on Facebook, I will take them right now. So if you want to be like, please answer this question, we'll do it right now. We want to make sure you're getting your questions answered. So this first one is, I was vaccinated while pregnant. Is my baby now protected to some extent? He was not tested for antibodies at birth. And Dr. Edlow, if you could take that one first, but could you also just explain a little bit? I don't want you to get too wonky, and I know you can be, because you're super smart, but can you just kind of a little bit more scientifically explain how in the heck does this vaccine go into my body as a pregnant mother, and then get into protecting my baby, those antibodies? Just go through that a little bit more so people really understand how this works.
Great. So these are great questions. And the short answer is yes. If you get vaccinated in pregnancy, your baby will be born with your antibodies, very likely, unless you get vaccinated right before you give birth. But if you get vaccinated some reasonable amount, even we think 17 days before birth, the baby will be born with some extent of antibodies. And then if you get vaccinated while nursing, the baby will also get antibodies through your breast milk. So that's the short answer. And then how does this all work? So for the mRNA vaccines, they have a little kind of sequence of a message to your body that tells your body to make the spike protein. And that's the protein that can show itself to your immune system and make your immune system make antibodies against the COVID virus. So it's not the virus. It's never going to give you the virus. There's no possible way that it could ever give you the virus. It just tells your immune system, look, here's a tiny, tiny piece of the virus, and now react to this. So if you ever see the whole thing, then you're going to attack it. And so our bodies make several different kinds of antibodies, and one kind are called IgG antibodies. And in medical school, we learn G is for pregnancy. So pregnancy has a G. So IgG is what crosses the placenta. So the IgG antibodies from mom are kind of grabbed in a very interesting way by what are called receptors on the placental tissue, and they're taken into the placenta. And then the placenta is an organ where the baby's and the mom's blood mixes. So when these antibodies get taken into the placenta, they get transmitted to the place where the baby's and the mom's blood mix and pass into the baby's blood, into the umbilical cord. And that's how the baby is born, with IgG antibodies from the mom's vaccination. The breast milk works a little differently. In the breast milk, the baby can be getting both IgA antibodies and IgG antibodies pass into the mom's breast milk when her body starts making them. And those are both delivered to the baby's mouth, nose, respiratory tract. We all know how babies can nurse. It kind of gets everywhere. And so we think that works a different way, that it's mucosal immunity. So it's immunity from coating all of your mucosal surfaces. And there's also some really cool research about how the baby's intestinal, what's called the microbiome, or your normal gut flora, can kind of have some dialogue or crosstalk with your immune system and actually make your immune system respond to certain things that babies see in breast milk. So it probably works a couple different ways to help protect breastfed babies, but that's a more mucosal immunity. The immunity that the baby gets from being vaccinated while pregnant is more bloodborne.
That's perfect. Now, so for everybody that hadn't gone to medical school, that was a pretty easy way to understand how this works.
I hope so.
Thank you for doing that. Thank you for doing that. And Dr. Henderson, we had another, thank you for the questions. Keep them coming because we now have a lot of questions. One question is, are those who are on birth control safe to get the COVID-19 vaccine?
Absolutely. If you think about it this way, the main risk that people think about with birth control are issues around clotting, or risk of blood clots or other risks for certain medical conditions. But the biggest risk is getting COVID, because there are also risks of having clotting or abnormal clotting with the infection. As you're, taking birth control to prevent from being pregnant, you're just like any other non-pregnant person at risk of getting COVID infection, and the vaccine provides the same protection to you as anyone who's not taking birth control. So I would absolutely wholeheartedly encourage any and everyone who's on birth control or who's already pregnant to take the vaccine.
That's great. This is one that I think, and then I want to come after this question that I'm going to pose to Dr. Henderson. I'll start with you, and then Dr. Edlow, if you want to chime in on this too. There's one about the booster shot that may or may not, we may not know the answer, although you may know this, Dr. Edlow. Maybe you could take this one first, and then Dr. Henderson the second one. The first one about the booster is if I get a booster during the third trimester, so I'm assuming they really have gotten 2 shots already, and then they'll be eligible for the booster in their third trimester. So if I get a booster during the third trimester, will the baby get the same amount of antibodies as if I only got 1 shot during pregnancy?
So that's a good question. So if you were getting the 2-shot regimen, the mRNA vaccines, so the Pfizer, the Moderna vaccines, as most people call them, that's the 2 shots that you would get in pregnancy. If you only got 1 shot, I'm assuming that maybe you got Johnson & Johnson. And I don't think that the CDC.
No, I'm assuming the question is they've already gotten 2 shots.
They mean they already got the 2 shots.
So
and
after they get the third, they'll get a third, but they're wondering, will I get the same? Will I get, how much of the antibodies will my baby benefit from? Because by then maybe the other antibodies that I got early on with the 2 shots would have
could be
waned a little bit.
Going away.
So,
yeah. Okay. So,
yes.
because I just want to make sure people know you need to get both shots. And that's something that our research has shown really clearly is, especially in pregnancy, that second shot, which is called the boost shot, even before boosters, the first shot's called the prime, the second shot's called the boost. The boost is really important in pregnancy, and you need to stick to the dosing schedule of your vaccine. So 3 weeks for Pfizer, as Lucy got, or 4 weeks for Moderna. So you should have gotten 2. If it comes up that you can get a booster, then it only could theoretically increase the amount of antibodies that you would transfer to your baby by increasing your antibody levels, because it's your antibody levels in part that are driving how much the baby gets. So it certainly won't diminish them. Maybe it will increase them. And that is an important thing that we're going to be looking at.
That's great.
Absolutely. Like I know from what I've read, some of the initial studies have shown that the boost increases the antibody production significantly, that third shot. So I would anticipate that you would still have protection for your baby from just getting the boost, because you should have some protection, lingering protection from the first 2 shots as well.
And Dr. Henderson, while I have you, this other one it's a good question too, really good questions. This one is, I had COVID-19 last summer and am now currently pregnant. I'm still planning to get vaccinated, but do we know how long the antibodies last?
Okay. First off, I just want to say that studies have shown that the immunity provided from the vaccine is much higher than that from natural infection, that those who were naturally infected had a much lower immune response than those who received the full vaccination. So I just want people to understand that, because that's another myth that's been circulating, that natural infection is protected.
Exactly. A lot of people think, well, I had COVID-19, so I'm already protected. And you're saying, no, not as much as if you go ahead and get the vaccine now and you're pregnant. It's really important to get the vaccine, even if you had COVID.
Very important.
Okay.
It's very important to be vaccinated. And I also think it's important for them to know that, having had COVID does give you some antibody response, but not enough to fight the infection as the vaccine does. Now, their specific question was, does it cause harm? I'm sorry, I missed the last part of that question.
They just wanted to know how long the antibodies last.
Or how long?
Yeah.
So natural immunity, they've been telling people that usually the protection is not much longer than a few months. However, we're from the vaccination, we're now looking at offering boosters after 8 months.
Yes.
So, but this is still an area that, that if you look on the CDC website and they show you things we know and things that we're still learning more about how long immunity lasts. And one of the things that, based on the evidence that we're seeing in our country and in other countries is that, which led to the recommendation for the boost, for the third booster shot, is that there has been some waning of antibody response. Yes. And it's important to know that waning has been more significant for those from natural infection. It's a much shorter period than those who've been fully vaccinated.
Lucy, let me ask you something. So you've gotten your 2 shots early in pregnancy. By the time your baby is born is probably when you'll be able to get your booster, or you'll be eligible for it. Will you get your booster then when you're probably breastfeeding?
Yes, definitely. I mean, I wasn't aware of the 8-month timeline, which is good to know. I was actually hoping the booster would be available, tomorrow for me. But I know
that's actually new. That just came out. The recommendation just came out maybe yesterday.
I think it was yesterday.
I actually was planning on asking because I know that in the early days of the shot, pregnancy was considered a comorbidity and was one of the things that let you get the shot earlier than your age bracket. So I was curious if they are recommending the booster for people who are pregnant, like sooner than a normal window. But if it is 8 months for me, that will be right. I'm due in December, so that will be January for me. And I will definitely be getting it. I do plan on trying to breastfeed. So if it is successful, I'll be getting it during the early days of my breastfeeding journey.
Mm-hmm.
That's awesome. And Serena, one of the things we haven't talked about is the fact that all of this stuff is so stressful. With getting COVID, getting the vaccine, I'm pregnant, I'm breastfeeding. It's just, and then we have these other issues around prenatal anxiety. And you, I guess a recent episode of your podcast, you discussed anxiety with 2 pregnant mothers to be. One of them was an ER nurse and a mom who shared what it was like treating COVID-19 patients and experiencing extreme prenatal anxiety and depression. And we certainly know that the mental health of pregnant moms and moms, postpartum moms, is a really serious issue. Is there anything you would learn from that you would want to share with folks that are listening today about how do you manage through all these conversations, managing your anxiety and your mental health through, a pandemic and trying to make these really, very important decisions for you and your baby?
Yeah, that was a really powerful episode. And I have to say that I joined my son's pediatrician to host this podcast to help get share stories, bring all mothers together, really debunk myths. And, there's a lot of misinformation out there, obviously. And we wanted this podcast to be like fact-based and something that all new mothers can rely on. So that particular episode was called Pregnant in a Pandemic. And we spoke with Hunter McGrady, who just had her baby. And then we had an ER nurse, Isla Collins, on. And yeah, she was treating COVID patients, triaging everybody and with patients with their last breath while pregnant. And she shares her extraordinary story. And I guess what I have learned, I decided to do this podcast because I am a new mother and I want to learn. Right? There's no like handbook on how to do all this and how to like navigate through the anxiety and all of the things that we're now faced with. So I am truly learning from hearing all these stories. And I think the one thing that I have learned is that we need to talk about this, and that mothers need to not feel guilty or shamed about sharing their depression, their postpartum depression, their prenatal anxiety, because we all go through it. We all experience it in one way or another, but we're just sort of like supposed to be this strong, glowing pregnant woman that's just excited to have a baby. And, you know, sometimes women are, and sometimes they're really plagued with some extreme anxiety and depression. And so what I've learned is just talking about it.
Yeah.
And so no one feels alone. There's no less new mothers crying in the shower and feeling totally alone. And I feel like we all probably can relate to those moments. So that's what I've learned, and that's what I want to share with all young mothers, is just
What about when you cry in the shower and you have an 18 and a 16-year-old? It never goes away, actually.
Well, Stacey, we want you on our podcast because I don't know. I need to learn from you. Oh my God.
Yeah,
my son's only 2.5.
Crying in the shower with motherhood just is a lifelong thing.
Okay.
It's never ending.
Right.
That's exactly right. We have a few more Facebook questions I think are such smart questions, you guys, so smart. So let's make sure we answer them. A couple more. And Dr. Edlow, I think I want to ask you to take this one. Let me do this one. Do pregnant women have similar vaccine side effects to non-pregnant individuals?
Yes, they do. There's no difference in the side effects in pregnancy compared to non-pregnant. And the CDC V-Safe registry looked at this really carefully in over 100,000 women and have found the side effects are really similar.
Right.
Just
right.
a real life case there. I have a twin sister who got vaccinated a couple weeks before I did, and we had pretty much the exact same reaction, except for I had morning sickness tacked on top of my like slight fever and feeling like I was run over by a truck for a day. She had the same feeling, but did not have the morning sickness to go with it. So we had a pretty similar reaction.
Oh, that's
the other thing that's important, I know people have been fearful of the vaccine because of the potential side effect of fever. And I know I've had to talk to people and reassure them that, they're worried about fever impacting their pregnancy or impacting their baby, and telling them that it's okay to take Tylenol, it's okay to lower your temperature, and just go get the vaccine anyway.
Yeah.
Yes.
And one other question is about the flu shot, because that's another thing we've always been recommending pregnant women get a flu shot, right? Because of the risk of getting the flu and elevated temperature and getting really ill if you're pregnant is with the flu. The question here is, should expectant and or new mothers wait to get a flu shot after completing their COVID-19 vaccination series? So should there be some separation in the time, or how should you sequence it? Or is there any guidance on that we're aware of? And Dr. Henderson or Dr. Edlow, whichever one of you want to take that one is fine.
That's a good one. And Dr. Edlow, please correct me if I'm wrong, but I would assume that you want to complete. I'm thinking about childhood vaccinations where we give multiple vaccinations at once.
One time, yeah.
And trying to think of a reason why we shouldn't be able to do that during pregnancy. And I can't think of any why they shouldn't be able to get both.
Yeah, I think initially, at least in our hospital system, when the COVID vaccines first became available, the advice to everyone, I think not just pregnant individuals, was wait 2 weeks between getting some type of vaccine and getting the COVID vaccine. And I think that was not from a safety standpoint, but more from the standpoint of, can your body like ramp up to make more antibodies, if you just made one to something different. But I think that guidance has gone away. And now, at least at our hospital, I know many other hospitals across the country, we are asking every person that comes in who's pregnant, did you get the COVID vaccine? If they didn't, we can arrange for them to get it while they're hospitalized on the postpartum floor. And we're doing that alongside giving them, measles, mumps, rubella. If they're not rubella immune, we're giving them varicella if they aren't immune to chickenpox already. So we're doing that with multiple vaccines. So I would say that guidance has sort of gone away. And I think extrapolating to the flu, if it's more convenient for you to get the flu shot soon after, within close proximity to getting your second COVID shot, or however it turns out, you should do that. It's important to get all of those vaccines.
Yeah,
for
get them
sure.
done.
Absolutely.
That's
The
good.
important thing is getting the vaccines. And
Yeah.
Yeah.
Whatever makes it easier for you to get the vaccine. That's why we're going around like room to room postpartum saying, do you want this vaccine with your prenatal vitamin? Yeah.
Mhm.
That's right. And then Serena, you may have had some questions about this one too. So after Dr. Edlow, maybe you take this one as well. But Serena, if this came up for you, let us know. There's a really good question about how much breast milk would it take to pass along my vaccinated antibodies to my baby? So is it after one feeding, or do I have to get through 10 feedings to give all the antibodies that I need to get to my baby? Like how much breast milk is needed to protect the baby?
I did have that question, and I asked my pediatrician, and he just was explaining to me that my baby will be protected as long as I'm breastfeeding, or well, he'll get my antibodies as long as I'm breastfeeding. But as soon as I stop, and you explained this, Dr. Edlow, then he won't have those antibodies. Correct?
Yeah,
that's a different one.
It's right. Yeah. It's not like the bloodborne antibodies
Right.
that get passed through the cord, where we're kind of actively looking at this right now, but we expect those antibodies to endure maybe even up to 6 months. We know from other vaccines like pertussis vaccine, the Tdap shot that people are advised to get at around 26 to 28 weeks of pregnancy, that those antibodies persist for at least 6 months typically. So depending on, when you got the vaccine in pregnancy, if your baby may still have bloodborne antibodies up to 6 months of age. Now, how much antibody level is needed to give you, 100% protection against a COVID exposure, we don't know. And so my advice would be don't test that and, like take your baby out to like crowded indoor places and things. Like I would sort of treat your baby in that same way as we do for pertussis, like the cocoon, make sure that all care providers and people that are holding the baby, grandparents, child care providers, et cetera, are vaccinated against COVID-19. And I still wouldn't be taking my baby, especially with Delta and how transmissible it is, to, crowded indoor locations, because it would be hard to mask the baby, obviously, at that age. So, but I would assume your baby would have some degree of protection as long as you're breastfeeding. And a lot of people have also written and asked me, well, I'm nursing and I got the vaccine for my infant, but I also have, a 2.5-year-old or even a 4-year-old or a 5-year-old. Can I give that breast milk to my other child in like smoothies or this and that? Will that protect my baby? And I think that's a grayer area. It's not known. And I think it's a very interesting area to study because a lot of moms want to know this. But if you think how babies nurse, and like I was saying, how they kind of inhale the milk and it like gets everywhere, to me, that would be a little bit more protective probably than just drinking a smoothie through a straw. And then maybe you're getting more of that, intestinal or gut microbiome driven immune changes if the baby's older and just drinking a smoothie or something.
Oh,
but
I had thought about that antibody smoothie. That's
people ask that a lot.
People
and I don't have good scientific data what to tell them, just sort of my own personal gestalt as having 2 kids that both, did nursing, and also then my kids don't like smoothies and they probably would never drink a smoothie with any milk, whether it's breast milk or whatever. But, I think I'm not sure that, drinking a smoothie would protect you as much as like nursing, or taking breast milk from a bottle.
But just to be clear, what you're saying is that as long as you're breastfeeding your baby is getting antibodies. If you stop breastfeeding, the baby is not getting antibodies, and those antibodies maybe they go away like quickly. They go away pretty. We don't know how quickly they go away.
Like a day, days.
So it's like a constant feeding of antibodies. Okay, I understand.
Right.
Yeah, and then we can't forget the ongoing benefits of breastfeeding anyway. So we wouldn't recommend that you just breastfeed your baby once and then stop.
Just to give them antibodies, right? Yes. No, you want to keep breastfeeding as long as you can, for sure. And
exactly.
I never imagined I would be a person that was breastfeeding a toddler, but because, like I said, because he turned 1 and then I continued to breastfeed and we did leave the house for a year. And now I'm like, well, I'm just going to continue to breastfeed him through this Delta variant, and and then we'll figure out how to stop. So that's been an interesting just personal experience dealing with people, questioning why I'm still breastfeeding my toddler.
Well, but good for
It's
you.
normal to
That's
breastfeed a
different-
2.5
That's a
year
different
old.
Yeah,
That's normal. That's not abnormal.
I think so too. Yeah.
and
Agree. It's
you're right.
normal and admirable.
You're better off for
to
it.
that, and some moms have trouble breastfeeding and like they
Mm-hmm.
plan to breastfeed, but it doesn't work out for whatever reason. So if you wanted to pump milk, we think it should give the same benefits. If pumping milk doesn't work for you because you need to go back to work or you can't do it for whatever reason, then there are other ways to protect your baby. So I think all ways of feeding our baby are okay. And there's a lot of guilt, like you mentioned, and anxiety around breastfeeding too. So it's great if you can do it and it protects your baby, but there's other ways to protect your baby if you can't do it with breast milk, which is good.
Yeah. So Lucy, what would you want all of this information? It's a lot, right? But at the end of the day, if a woman's pregnant and she's been struggling with making that decision to become vaccinated, what would you want her to know about the decision that she has to make?
I mean, first and foremost, I'm sure anyone who's pregnant has been seeing information in the news coming out about pregnant people who are contracting COVID-19, who were not vaccinated, and the outcomes that they're having. And I think, keeping in mind the difference between someone who is vaccinated and someone who's not, and the outcomes for both themselves and for their babies, I would encourage people to just remember that. I also would say, listen to these women who are medical doctors on this panel who are doing this research. Listen to what they're studying and look at the data that they're finding and trust it. This is medical research from top-notch doctors who are doing, spending their lives doing this research to help us. And, instead of just, I understand the fear of, you hear about a vaccine and it's this unknown vaccine and there's not a lot of research and it's a new thing. But, I think there's been enough research at this point to know that an mRNA vaccine is not the same as, say, the varicella chickenpox live vaccine. That was something that was confusing to me because right before I got pregnant, I was told that I never had chickenpox as a child and I wasn't up to date on my chickenpox vaccine. And I needed to get that vaccine, which also had another booster shot 3 weeks after. And I was told, do not try to get pregnant in this 2-month period while you're getting your chickenpox shots. And so, of course, naturally, my brain had a fear about, well, now there's another virus shot that I need to get vaccinated for. Why is this one safe for me to get during pregnancy and this one's not? And I think just understanding that there is a difference between the two types of vaccines and how they move through the body and how they could actually affect a baby or you. And so I think those are important things to keep in mind. And then I guess just take it from a current pregnant person who has a baby who's literally kicking right now as I stand here, who, was nervous that it was going to cause all these problems and nothing happened. And instead I can, as you mentioned, go through my pregnancy somewhat, I think I probably am still being a bit more cautious than the average vaccinated person who is not pregnant, which I was going to pose the question to you guys, the two doctors. I was going to ask about if a vaccinated pregnant person is actually still at a higher risk than a vaccinated person who's not pregnant, or if the fact that I'm pregnant doesn't mean anything now that I'm vaccinated. So I was going to ask that question, but I do feel a sense of general ease as I go through the world. I live in New York City. I do wear my mask everywhere. I have decided to stop dining indoors for now, given the Delta variant, even if it is a restaurant that mandates vaccines. But I feel like I'm going to my best friend's bridal shower on Sunday and I'm going to enjoy it. And that's what I would say.
And you can always wear a mask, which is just
Exactly.
another protection.
Yes.
Yeah. We're just about out of time, but there is one, Dr. Edlow, I think you wanted to add just one more point about something Lucy brought up about the difference in this vaccine technology and how long it's been around. That some people have said, oh my God, it just came about. And it's like, please, can you just set the record straight about mRNA vaccines and that technology?
So mRNA vaccines first started being studied in the 90s, and the kind of technology that really perfected our ability to have that RNA in our body happened in 2005. So Moderna actually stands for modified RNA. So that company was founded in 2010. And in 2010, when BioNTech and Moderna were both founded around 2010, 2012, they were both around using RNA vaccines and using RNA technology to fight disease. So this is not a new idea. So I just want to reassure people about that, because even though COVID-19 is a new infection and it's the first one where we've made this work in rapid time, this idea that this could happen has been in the scientific community since 1990.
Yeah. The polio vaccine was pretty new and innovative at its time in the 1950s, and the March of Dimes was 100% behind that. We're 100% behind the vaccines that are out today because they continue to protect people. And our entire history and our legacy of organizations based on safe and effective vaccines. So I want you all to know that this is really important to save your life as a pregnant person, to protect your baby, to give life to your baby and a chance at health, even while you're pregnant or breastfeeding. This is why we're doing this today. And I want to thank all of our amazing guests for being a part of this today, this great webinar. And thank you for all the work you're doing, both of our doctors, and Lucy and Serena. Thank you all for being such important voices on this issue and for helping to debunk some of the myths and really calm the fears that so many, pregnant people and breastfeeding people have about COVID-19, about the vaccines. It's really important. I just want to say before we leave, we have a ton of resources that if for some reason, I think we got to a lot of the questions, if not all the ones that I saw, but if for some reason you still need to look at some more information, let me just share with you some resources that exist. And here's some links here. If you just go to the March of Dimes page and put in COVID-19, you'll get a bunch of different information, resources, a lot of different information that we're putting out publicly. Of course, as Lucy did, going to the CDC website and looking at the area that talks about coronavirus and pregnant people is always chock full of information. I mentioned ACOG, the American College of Obstetricians and Gynecologists. ACOG's website has a lot of information. The American Society for Reproductive Medicine, the American Academy of Pediatrics, and Society for Maternal Fetal Medicine. If you want to take a screenshot of that and keep those links, that would be great, because you can always go to those and make sure that that you can get more information. And it's always, these websites are always being updated with the newest and best information as well. Last thing I'll just mention is that we finally got on the bandwagon with Lucy, and March of Dimes is on TikTok. I'm so excited about it. So we share a bunch of information about just being pregnant and being a new mom, and and all of the things that you might want to know about. So please follow March of Dimes on TikTok and engage with us. And if there's information you want us to share, and you can let us know through TikTok, we'd be happy to answer your questions there too. Also, don't forget that this coming Tuesday, on the 28th, is Giving Tuesday. And frankly, we can't do this work that we're doing even today without your generous support. And we are always so grateful for the public for supporting the great work that we do at the March of Dimes. So if you would like to participate in our Giving Tuesday day, which is this coming Tuesday, I think the 28th, please make donations, and you can text MOD GIVE to 51555. You can go to our website, but we certainly would appreciate all the support that you have to give, and we're certainly grateful for that. I think it's not this coming Tuesday, maybe the following Tuesday, but anyway, Giving Tuesday is coming up soon, or any day can be Giving Day to the March of Dimes, is what I would say. So you don't have to wait till any random Tuesday, you can give anytime. So anyway, well, thank you all so much. We're so grateful for all of you all for joining, and thanks to all the panelists, and we hope to see you soon at one of our next webinars. So great to see you all today. Thank you.